Hey everybody, welcome to another episode of Mind Matters, Navigating Head Injuries and Concussions. I'm your host, Kiley Como. I'm the legal nurse consultant here at Shane Smith Law, and today we have with us Dr. Erik Reis, once again from the Neural Connection.
That is, yes. Thanks for having me on again, Kiley. Appreciate it.
Of course. Glad to have you back. Always great to have Dr. Reis on with us. Got such a wealth of knowledge and content he can just kind of rip on. So it should be a great conversation ahead for everybody listening. So Dr. Reis, let's jump on in. One of the things that I really wanted to kind of come back to was kind of your story and how you kind of got into the area that you're in, neurology, the treatment of brain injuries, concussions.
Yeah, I think there's always a great story behind people who have passion for what they do. I didn't really sign up for my story and the reason why I got involved in this. I've played contact sports my entire life. So growing up in the Midwest, playing ice hockey and soccer was just what we did. And so I didn't think anything of concussions. Like I was aware of it, but back in the early 2000s, it's like we knew what concussions were, but if you got one, then you took care of it. But if not, you go out and you skate again or you go play. Essentially, my story starts off with me being a patient first, right? So having head hits, fortunately, I didn't have one that was career ending or game ending, but I know what it's like to get my bell rung. And I distinctly remember moments after sports where I would be like, okay, I feel off. Or my parents would say things to me and I'm like, what did you just say? Like just feeling foggy and just kind of like an airhead, right? My dad would always say, like, don't you remember this? And I'm like, I don't. And now looking back, there's a lot of clarity with that. And so, being a patient first has really just shaped the way that I look at treating these conditions. But then being a doctor second gave me the knowledge and the experience and the understanding of what I can do clinically to help people who are in my position as well. And so now being an advocate and educator third is something that has really just shown me that you can really kind of take a negative and turn it into a positive. But furthermore, there are still so many people who haven't had the help that we've been fortunate enough to acquire for not only for my health, but for my patients' health. And that's my whole focus now is to say, listen, I'm going to continuously forever be learning about brain injuries and concussions because things change so quickly in this space. But it's so important to understand and have a perspective of what a patient is going through. And by being a patient first and a doctor second and an advocate third now, I really have a unique perspective that has really changed the way that I treat patients.
If you're passionate about your field, I think it just comes naturally. But I think to give your best to the patients, you've always got to be out there kind of on the outer edge, just kind of seeing what's new, what's happening out there, advances, et cetera. So that's an amazing story. I spent a little time again going on your website, reading some of that. I wanted to see what your patients said, and I read a lot of testimonials again from patients from the Neural Connection, and a lot of them mentioned, having treated with a previous provider, but they didn't really make a whole lot of progress. And I saw a few of them say, I felt unheard or unseen. So how do you or your team overcome these challenges with these patients when they come to you?
It's all about being intentional. We, from the get-go, have always been focused on making sure that we listen to our patients, we ask them the right questions, but then I also give them enough space, and we're kind of holding space for them to feel safe, to feel trusted, and to make sure that their experience has been different than anywhere else that they've gone before. Listen, there's a lot of phenomenal providers and doctors out there, but unfortunately, in a lot of situations, they're either placed into a system where they don't get enough time to invest in the relationship building and the understanding of the person in front of them. Patients are not their diagnoses. They're human beings who unfortunately have some sort of clinical condition, and that's why they're coming to see you. But you have to treat them like the individuals that they are. And that means understanding them emotionally, understanding them, spiritually, understanding them physically and mentally, and what goes with that territory. Because the brain is so complex and it involves all those things. So we're really intentional with making sure we spend time with our patients. We're taught in school, 80% of your diagnosis is taking a history. Well, I really think 80% of success in practice is understanding the person in front of you and building up that relationship and trust. And that's always top of mind for us in the office. After that, it's all the clinical things that we try to understand, right? So it's the structural, yes, it's the neurological, yes, it's even digging into metabolic and nutritional factors, but then it's the emotional side of things. I could do all of the therapies, all the treatments, and have a perfect protocol. But if that person is not emotionally engaged, or if they don't feel safe, or if they're in a situation where they don't feel like they have safety and they're always under stress, then they're not going to get better, even if I have the latest and greatest advancements in technology. And so as difficult as that is to navigate, what I've found is that every day is just me trying new things and seeing what sticks and seeing what doesn't. And every single patient is different, and I just have to treat them that way. So we're very intentional, we're very focused, and we're really keen on making sure we approach everything in a specific way, just to try and get the benefits and the outcomes that others haven't.
The brain is a lot different, and so the fact that you highlight the fact that everybody is so unique is key here. What does the typical course of treatment for a client look like? Especially with today's advances in telehealth, so many different ways to diagnose various brain conditions. What might that look like?
Yeah, there's never going to be a replacement for a bedside examination. A proper bedside neurological and orthopedic examination is invaluable, in my opinion, because I can talk to somebody on a consultation. I can, do a video chat with them like we're doing right here. But until I get them in the office, till I kind of feel their energy, till I can actually get my hands on, what their neck feels like, do an examination, do things bedside and really get the data that I'm looking for, I don't fully know what I can do to help them. And I tell patients that. I say, listen, if you're questioning and you are curious, I can talk to you about our philosophy and what we do and why we do things differently, but I'll never be able to give you a definite answer until I can do a proper bedside examination with you. And that involves diagnostics, right? So we run video nystagmography, which is an objective visual test to look at, can your eyes stay steady on targets? Can you track? Can you hit targets? Some basic things that are really nice for us as providers to quantify, but also for patients to see, because how many patients are looking at these things? Very few, if not none, right? And I've yet to have a patient come into my office and tell me exactly how to treat them, right? So it's my job to figure that out with an examination. So once we get through an examination, it kind of depends on what the patient can make happen. So I have patients in my office right now who've been involved in MVAs, and I'm seeing them 3 times a week. It's not forever. It's not for the rest of their life. I'm not a big believer in that. The goal is to see them as frequent enough to make changes. But I am the first person to say, hey, listen, let's decrease visits. Let's decrease visits. Because what I'm trying to do is I'm trying to send them home with home therapies. I think your life, in all aspects, is far better spent outside of a clinic, right? And so keeping that top of mind is really important for me as a provider. I want to make sure I'm giving them enough support and guidance and feedback, but also making sure that they're able to do things that they weren't able to do before. So getting them to go back to doing ADLs, maybe it's doing dishes or spending time with a loved one. I had a woman in my office earlier today, she's getting these massive headaches because her daughters are in gymnastics and she's going to watch her daughters go practice, something she's done for years. But after her auto accident, she's got a subdural hematoma. And so her vision is off. And now she's getting headaches that occur because of really busy visual environments. My goal is to get her to be able to do that again without the headaches. Making sure I understand their goals and their, what they're looking for. That's really at the end of the day what I'm looking at. I don't have a set plan. I don't have a set game plan. Every person's different. Some patients travel to see me 2 or 3 hours. I can't see them every day. I don't want to see them every day. Maybe I only see them once a week, and that's enough. Perfectly fine with me. It's all about that personalization and making sure that they're getting the results that they're looking for. But I think the bigger thing that comes with that is this first thing we touched on, which is building trust and making sure they understand the game plan, which is that we're going to do therapies in the office, but I'm absolutely going to keep them honest with the home exercises that I send them with too, because that's really where I see a lot of the healing occurring.
Treating certain bodily injuries is fairly well known, but with the brain completely different. So I imagine that may come as somewhat of a shock as far as what might be expected of them with regard to the treatment process. Do you find that most people are pretty accepting of what you're asking them to do, or do you find that you get a lot of pushback? Because brain recovery is hard work.
It's really important for us to set expectations early on. And what I tell people is say, listen, based off of the examination, I'm optimistic that I can help you. I don't know how long it's going to take, because I really don't. And anybody who says that they do, you should run the opposite way, because there's no guarantees, especially in neuro rehab. And that's just the unfortunate truth, right? If you talk to somebody and they say, I know exactly what to do with you, we know exactly what's going to happen, it's going to occur in this time frame, you need to put your flags up, because there's no guarantees with that in any aspect of medicine, especially when you're doing neurological rehabilitation. So I say, listen, here's what I think I know. Here's what I don't think I know. Here are the expectations that I have. We're always continuously having open communication and opening that dialogue. So I really don't get any pushback because I tell people exactly that. I say, listen, here's what I expect. Here's what I think is going to happen. If it doesn't happen, then we revamp, we do a reevaluation, we reassess. And patients know, like, I have no hesitation kicking them out of my office if I'm not getting progress or if I think their time is better spent with somebody else. And I think that's why a lot of people do reach out to us. I mean, we're based in Minnesota. We get calls every single day from other states and different parts of the US and even outside of the US because people are aware of what we're doing. And even if they popped on a call with us for 10 minutes to get the right direction to find the care that they need, well, that was worth their time. We've really trying to position ourselves as champions of giving people really quality direction on their healthcare. And especially when they become patients of ours, they kind of know the expectations because once we both have that, then we understand the game plan and we can work together as a team.
Yeah, that complex process, remain fluid, kind of limit the expectations up front. That all makes a lot of sense. So in your experience, given how unpredictable recovery can be, what factors do you think most significantly affect the length and the quality of recovery?
So I was just having a conversation with a patient about this earlier today. This woman was involved in a severe rear-ended accident. A truck essentially ran into the back of her car where she was nearly completely stopped and they were going at highway speeds, right? So she suffered a subdural hematoma, which was found on MRI, and she was just wrecked, right? She was not in a good position. But she was very physically active before this. She's a 10-year yogi. She works in the industry. Was a collegiate athlete. She's never stopped moving. So she was very physically and physiologically very healthy. She's recovering at a rather quick rate because the state, the neurological, the metabolic, the emotional state that she had prior to the injury will have a massive impact on her recovery time and who she will return to be after that injury. Because no two injuries are the same, right? And the same is true for somebody who may not be very healthy before an injury, who may have things like type 2 diabetes or hypertension. Maybe they're not exercising. Maybe they're a poor sleeper. Maybe they're just overworking themselves and they're just under chronic stress. That is a very different state to be compared to, even if it was the same injury, compared to somebody who is doing all the right things to keep their health in check. And so what I would say is that is a massive factor that I've witnessed clinically that I would say is, for better or for worse, something that we have to take into consideration because you never know when you're going to get into an accident. Hindsight's always 20/20. You can't change the past. If you were involved in an accident and you didn't have a great state like that, the question is now what can be done about that? And so that's a really hard timeline to give, but I would say people in those situations are talking more into like the months, potentially even up to a year, or even more possibly depending on the severity of their symptoms. And that's where things get kind of difficult, right? Because in a lot of situations, depending on the auto insurance company you're working with and the reimbursements, companies are going to say, oh, well, you've been treating for however many sessions or however many months or weeks in duration. We think you've reached maximal medical improvement. But how are they gauging that based off of that? Well, they're using statistics. They're not necessarily saying based off of this person's physiology, their background, their genetics, their epigenetics, all of the things we talked about. There's no set timeline, unfortunately. For me, what I'm really focused on is saying, listen, what can we do today in this moment? Some patients, as weird as it sounds, may need a lot of nutritional and metabolic support because they're already nutritionally deficient or metabolically unhealthy prior to the injury. And now we know that these symptoms are actually being propagated because of underlying inflammation that was there before.
Yeah, I think, most of my clinical experience comes from, that acute side. So the neurosurgical ICU setting. So you mentioned subdural hematomas, countless patients I've had to take care of that have suffered some devastating subdural hematomas, but, other intracranial hemorrhages, subarachnoid hemorrhages, that sort of thing. And one of the things I would have to kind of parrot what you're saying. I would think one of the bigger factors that was a kind of future predictor of possible success, right? You can't ever count on it, but was that health coming in? Did they take care of themselves before? Did they have a lot of comorbidities coming into it? Diabetes, hypertension, being obese, just out of shape, whatever you want to call it. All those things tended to be on the healthier side, if you want to say that, tended to get better quicker on the acute side again. I didn't see much of the long term, but one of the things I did see also, interestingly, was the older patients that I took care of. So as you know, when we age, our brain atrophies quite a bit, shrinks down, so you've got a lot more room inside that skull for processes such as swelling or what have you. And so sometimes being old played in your favor. Yeah, there were complications that went along with that also, obviously. The brain tissue is not as elastic and didn't rebound as well. So yeah, it's kind of a double-edged sword, but some very interesting outcomes when it came to the different again, age groups, or breaking it down into healthier versus unhealthier patients. Young folks tend to do pretty well. They heal much quicker.
The other thing too is gender does as well. I mean, we're finding that females, women, unfortunately, are a little bit more susceptible, a little bit more prone to having longer term post-concussion outcomes. And the reason why is a couple reasons. One is there's less reporting of concussions and head injuries in women's sports than men's, which I don't know if that's a social thing or if it's just maybe we don't expect it to happen as much based off of that. I mean, there's much to kind of debate in those realms. The second discussion point is the mass or the girth of their necks are usually smaller, right? So they don't have as much muscle mass, which will not be able to actually absorb as much force if you take a hit, and you can be able to kind of neurologically, muscularly be able to absorb that force going in to take that instead of going into the head, right? So it's not perfect, but it does, to a point, according to the literature, have an influence. But then the third thing is actually the hormonal fluctuation. So there are some studies pointing to whether women have concussions in the early part of their menstrual cycle or after their menstrual cycle. So you're talking about estrogen and progesterone. Well, progesterone is a really potent anti-inflammatory. And so when you're looking at the hormonal profiles of individuals, sometimes those factors can play a role. Well, administering progesterone, regardless of where you're at in your cycle, or even for men, does that have an anti-inflammatory response, feedback to the pituitary and the hypothalamus, and potentially calm down inflammation in the brain? That's some of the early conversations that have been happening. I don't think that there's a ton of conviction there yet. It makes you question, it makes you realize there's never going to be a one-size-fits-all treatment protocol. And I think that's where a lot of people struggle.
I mean, if you even just stop and think a moment about the complexity of the human brain, I mean, none of that is shocking what you just said. Just the sheer amount of what we don't know far outweighs what we know, certainly. So it's very interesting. I hadn't really read much on or whatnot about the neuroprotective qualities, if you will, of the hormones as it relates to gender. There's a lot of concern about the effects of multiple concussions, that stacking effect over a person's lifetime. How do you assess that and manage those long-term risks for those individuals that do have that history of repeated head injuries?
It's one of those things where I'm aware of it, and all I can do is do the best that I can with the patients that I have in my office, right? So I, theoretically speaking, am a great candidate for somebody to be set up to have neurodegenerative issues years, decades, hopefully never, let's say, but like in my 50s, 70s, 80s, and 90s, because I played ice hockey and I've played soccer, both of them at a relatively high competitive level. But the factor is that I'm doing things today that I know will either stave off, stop, or reverse those changes from ever occurring in the first place. Eating well, sleeping well, moving well, thinking well, right? Like all the things that we know are fundamental and foundational staples for taking care of your brain and body. And the research continues to justify and validate it over and over again. One of the best things you can do for your brain is physical movement and exercise. And it's a variety. High interval training, great, cool. But lifting weights, phenomenal way to build muscle, which is coveted real estate these days to help balance your metabolic profile, right? You were even understanding there's like little messengers, these myokines that come from muscle that benefit brain health. And then on top of that too, cardiovascular exercise, right? So all of these factors play a role in brain health, and it's one of the strongest predictors we have of staving off any neurodegenerative condition, regardless of whether or not you've played contact sports or not. So with these patients who come in with a history kind of like mine, I say, well, what are you doing today? And then the next question I ask is, what should you be doing today? Because everybody knows what they're currently doing today. And most people know what they should be doing, but they're not always owning that. Until you are exercising consistently, getting a high quality and quantity amount of sleep, staying hydrated, eating foods that came from the ground at some point, and being around people that make you feel loved, safe, and secure. Until you have all of those locked down, I'm not having conversations with you about vagal nerve stimulation or cold plunges or taking NAD plus and doing infusions of vitamins, because those things are so trivial compared to the fundamentals of what people actually need to do to keep their brains healthy. So the game doesn't change for me on that. If I have somebody who's dealing with like mild cognitive impairment, or they're dealing with, postural changes or things like that, then I say, hey, we actually might need to be even more aggressive with some of these things. And now we do it all at once, but now I'm getting specific with things like NAD plus and acetylcysteine, supporting acetylcholine transmitters, things along those lines. So it just depends on where they're at, and I just have to meet them at that crossroads.
As you were talking, it got me to thinking about just how far we come with concussion or brain injury treatment in the last decade or two. I mean, I can remember when I was a young guy, been a few years, but concussions meant rest, go lay in the bed, sit on the couch, turn the lights off, just really shut things down. But
of course.
Nowadays, we've learned that's the wrong thing to do. It's get back to activity. You mentioned, proper nutrition, maybe supplemental, whether that's supplements or the new medications that we have. But I think the biggest thing has been that getting back to activity, and it's not just going full bore, right? I mean, there are measured protocols like the Buffalo concussion treadmill or bike.
Exactly.
Can you speak to a little bit about your thoughts about these changes we've seen in the last decade or two where it comes to activity?
They're genuinely just updates about what we know about how the brain and body respond after an injury. The beautiful part about your brain and body is that it does respond to stressors in specific doses, right? So if Kiley and Erik are constantly stressed and we're overworked, we're underpaid, we're always just releasing, stress hormones, our brains and bodies are going to shut down over time. I mean, it's one of the reasons why fundamentally you can only get so many cortisone shots into a tissue, is that cortisone, which is equivalent to cortisol, the stress hormone, it breaks down tissue, unfortunately. But it's a great anti-inflammatory in really short bursts when it's appropriate. And so the same thing is true with even like the Buffalo treadmill concussion protocol, is we're finding out that within reason, and what they're essentially looking at is looking at heart rate jumps and then symptomatic onset to say, listen, Kiley, you just had a concussion. Yeah, you can take a couple of days to relax and recover, and that's not wrong, right? You can sleep and get some good nutrients and things like that. But once we can kind of start pushing you down that path a bit of just movement, right? It's not going for a CrossFit workout. It's just movement and walking, low-grade cardiovascular exercise. When we're looking at that, what we're realizing is you're increasing blood flow to the brain. Now, the brain does some really interesting things. And the way that functional MRI machines or MRI machines work is that if I take your left arm, Kiley, and I have you just move it, right? What I'm going to see in an MRI is I'll see your left cerebellum and your right frontal lobe kind of light up like a Christmas tree. Well, what I'm seeing is I'm seeing blood flow increase in those areas, and I'm also seeing neurological activity increase in those areas. They're directly linked and correlated. What happens after a concussion or a traumatic brain injury is those correlations now are inverse of each other. So if I tell you to move your left arm and I put you in an MRI machine, I'll see neurological activity increase, but I'll see blood flow decrease. So now you're losing out on all the oxygenation, all the nutrients, and all the neurotrophic factors that are going to help you repair that tissue. And what happens is your brain tissue now struggles to survive because you can't get rid of toxins and get put in new metabolites. So what the cardiovascular focus is on is increasing that blood flow, making sure you have these direct connections again, and you're enhancing the opportunity for the brain to recover in that way again. And so the focus with low-grade cardiovascular exercise is to increase blood flow to the brain in areas that are no longer sustaining that blood flow like it was prior to the injury, which is a beautiful mechanism. It's also sometimes a bit grueling for patients, but you do it within reason. You look at heart rates, you're looking at autonomics, and you make sure they can handle it without pushing their symptoms too much. Over time, that's a great low-grade stressor. The brain and body adapt and change. And then hopefully over time, symptoms improve where you're now back to functioning on a regular basis, and the post-concussion symptoms are hopefully decreasing in quality and quantity.
Seems so simple, but what an amazing advance. Okay, everybody, that's going to do it for another episode of Mind Matters, Navigating Head Injuries and Concussions. We've been joined today by Dr. Erik Reis of the Neural Connection. I hope you've enjoyed this conversation just as much as I have, and please come back next time when we're going to have a part 2 to this discussion. We'll continue talking to Dr. Reis about traumatic brain injury, concussions, and all things brain related. So if you would, hit that like and smash that subscribe button if you want to keep up with our latest and greatest content. And as always, if you're in pain, call Shane at 980-999-9999.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.